All right. Everyone can see me, right? All 0 of you. I'm going to wait till 4:02 and then we'll start the live and ultimately post this for people who can join later but couldn't join right now. One of you, that's awesome. Thank you for joining us. All right, for all one of you and my guest, I'm gonna start. So hello and welcome to Reveal with Dr. KP. I am Dr. KP or Dr. Chinwe Padua, and I'm your host and your friend, and I'm also an American board certified plastic surgeon. Revealed is a show where you, share what plastic surgery you've had done, what your motivations for it were, what your experience with it was, what lessons you've learned, and what you think now, and would you do it again? Some notes for the show. Ultimately, this is a show about education. It's a show about engendering some understanding why people get plastic surgery in the first place. And also, if you are going to embark on your own journey, hoping to give you some information so that you can make a more informed decision moving forward. This is a show about being encouraging, being supportive. It's not a show about bashing people, places, or things. So we want to keep comments and everything as positive as possible. If you cannot uplift, then shift. Okay? Also, for anyone on the show, guest, expert, no one is exempt from being asked the question, which is, what have you had done? And without further ado, I'm going to tell you how you can be part of this too. So there are a few ways that you can join us here on Revealed. One is you actually dial into the live and you yourself share your journey on your plastic surgery. And I'll post that link now in the comments. Two is that you can comment. We love a good comment, and I mean a good comment, meaning that it's encouraging and that it's supportive. And then 3 is that you can always like and subscribe. All right? So with that, I'm going to add to the stage our first guest.
Hello, how are you?
Hi, how are you doing?
I'm pretty good.
So I wanted to be upfront. So I found you on TikTok.
Yes.
And you made this great post about people dying from BBLs.
Yes.
Do you mind just quickly, before we get into what you may or may not have had done, what was your motivation for posting that?
So I am a group admin owner of the group called Atlanta Plastic Surgery on Facebook. And I started that group because I myself have had plastic surgery in the past, and I was always a person who would do research to ensure I'm doing the right thing. But I will always come across people who would, push about, hey, this is cheap. I want to get this BBL. And just me being nosy, I'll go research the doctor and I find out that they're a dentist. And I'm like, oh, well, I do understand you want to get a BBL and the price is very inexpensive, but this is my recommendation. And I would go back and forth with a lot of people. They would say, well, I did my research. And I would try to educate them to let them know, like, hey, these are the sites you can look on. And in certain states, you don't have to be a board certified plastic surgeon to do plastic surgery. And that was a reason for the post, because it's like, if I can educate somebody on the importance of, looking for a board certified plastic surgeon versus just looking at these pictures online of, butts that look good or plastic surgery, anything that might look good and it is inexpensive. If I can educate them on that, is not what's important. It's the importance of who's actually certified and, educated on exactly what they're doing. So that's why I made that.
Well, thank you. And that's why I wanted to have you as one of my first guests on the show. So, am I pronouncing your name correctly when I say Tanny?
Tawny.
Tawny, excuse me.
Yeah. You're fine.
Okay. Are you comfortable sharing what you've had done?
Yeah, perfectly fine.
Okay. All right. So what have you had done?
Okay, so back when I was younger, I used to be on the depot shot and I gained a lot of weight. And this was maybe 12 years ago. I'm 37 now. I might have been like 22. I got off the depot shot because I learned that, me trying to work out and do all these things just wasn't helping. And, I went and got liposuction. That was my first time getting liposuction, and I was kind of happy with the results. Later in life, I found out I had PCOS. And then I was like, okay, I'm working out. I'm doing all this stuff. I'm not losing weight. Like, what's going on? Maybe I need to get plastic surgery. I moved from St. Louis to Atlanta. I ended up researching, and I was like, okay, since I'm going to get lipo again at this point, because I wanted it again, I might as well do a BBL. I started researching these doctors, and I found this lady. Her name was Dr. Boutte. And I was like, oh my gosh, she does it so good. And I'm going to go to her. I went to a consultation, I learned about her. But when I'm walking in, it said dermatologist's office. And I was like, okay, let me go back home and do a little more research. Did a little research. She wasn't a plastic surgeon. She was a dermatologist. Luckily, I did not get the BBL at all. After that experience, that's when I learned about different states not, letting any doctor do plastic surgery.
Right.
So that turned me down from a BBL, and I said I would never get a BBL. That's just out of the picture. I'll just do lipo. I waited a while because I was like, I want to have a baby. Had my baby in 2020. And after the baby, I said, okay, I'm getting the works. I did my research. I found a double board certified plastic surgeon. I got a tummy tuck. I got lipo. I already had breast implants like years ago. So I ended up getting the breast implants removed and got smaller implant. I did a breast lift. I got my arms lipo, not all at the same time because the plastic surgeon didn't recommend doing this all at once. So we did wait a year to do. So I did the tummy tuck, the lipo 360 all around. And then I did the fat transfer to my hips during the tummy tuck. Then a year after that, I went on and did the breast implant exchange, the arm lipo, and the breast lift. And then I ended up doing skin tightening because it was like I had my back after the tummy tuck. I was like, well, I got all this fat on my back. Do I need a back tuck? And he was like, no, you could do like morphosis and skin tightening. It worked, and I was literally happy with my results. So I've had a lot of surgeries. I did a full tummy tuck with muscle repair, and that was it. I didn't do the BBL, but I'm glad I didn't because I really just needed a fat transfer to my hips.
Fair enough. So you had enough projection, looking at from the side, but just getting a little bit of hips fat was enough. Yes. That's really good. And I will say that you are not the typical person, right? Because I hear a lot about women going to a person who's called Dr. Boutte, and this is no shade to her, right? So I don't want to start saying that I'm bashing other people, other physicians, but and they see the befores and afters, and then they're convinced, okay, I'm going to her. And they look at the reviews, and the reviews are nice, and they're like, okay, I'm with it. So for you to actually see all of that and then do more research to find out that she was a dermatologist and so not trained to do any of that, it's great. It's actually awesome.
Yeah, it made me dig a little bit deeper because at the end of the day, I have learned that no matter what you see online, don't believe it. Like, somebody can look amazing, and in reality, you might see them in person. You're like, okay, well, that's not what I saw online. Or you see these pictures of the surgeon doing this, and I'm like, come on now. There's Photoshop and all these cool apps. Like, me personally, I don't believe anything. I literally have to see it in person. Like, even if I found a review online or somebody in the comments, like, I'm the person that will reach out to an individual, like, hey, give me your real deal of like what your experience was. I don't care about the reviews because that could be fake. You could pay people to do reviews. Like, I'm a big researcher, so I'm gonna find something.
Well, I love that. I really do love that. Can I ask you, and do you remember about how much you paid for everything?
Total, well, I would say the big surgery, like the tummy tuck, the lipo, the skin tightening, all that. I would say if anybody really wants to get really good plastic surgery, 60,000. About 60. Yeah.
So that's a lot. That is a lot, but not in a shady way. That's just a lot for people to be able to afford. And even if they're doing it in stages, that's still a big commitment. So what do you say to people who are like, that's too much money, or
So
you
the
could probably
biggest
get
thing
it
is,
done cheaper, or, you know?
yeah, I'm gonna say the biggest thing for me was, I would say 60 total over the lifetime.
Right.
Now, I did do mine in stages, and what I did learn was that the biggest cost of like getting plastic surgery, honestly, is the one of the biggest costs. I'm gonna say the top two is the anesthesia. Like that cost right there alone is gonna be, depending on how many hours they have to put you to sleep, like
Yeah.
you have to think about that kind of stuff. So the doctor could say, "Oh, I'll do breast implants." Breast implants are like 5,000. 5,000 sounds good. But guess what? I have to cut you open. I have to put you to sleep. It's gonna be a
Mhm.
3-hour process. I have to sew you back. Like it's, you gotta factor that stuff in. And when you
Yeah.
physically think about it, it's like, okay, you're just paying for the implants. The implants are 5,000. But you didn't
Right.
copped in the, they have to clean up, like you have to, I'm a mortician as well, so it's like all these things you have to do on the side, like they have to clean the office up, they have to pay all these other people. It's just not like, hey, I gave you 30,000. Like, initially it was like my
Yeah.
tummy tuck and tummy tuck, the fat transfer to my hips, that probably was like 22,000.
Hmm.
But it's like if you factor all this stuff in, some people even aren't educated on the thing where they're like, oh, well, will it be cheaper if I just do everything all at once? And it's
Right.
like, that's not safe. Yeah,
Right.
somebody will do it to get it out the way, but you're about to be put to sleep for 6 hours and they need 10 hours because now they know that the tummy tuck takes this long. And it's like, now you want to do the boobs. And it's just not smart to do. So I would say for somebody who can't afford it, if you can't afford it, you might honestly not need it. Like it might be one of those things where
Mhm.
it's like, I waited to do this when I financially stable, had a 401k, had a job. Um, I'm not just, and I did it for myself. I didn't do it for other
Right.
people. Some people are like, oh, I'm gonna do this so I can get a man or do this. This was literally for me. And I knew after I had a kid, I said I want to set money aside because I don't know if my body will get messed up, but just in case, I'm gonna set money aside before I have this kid. And that's what I did. So that was another thing. It's just thinking for the future. Like even when you get older, if you get wrinkles in your forehead, set some money aside for Botox, or just start setting money aside just like you would do any savings account. Because I
Yeah.
mean, we all want to stay youthful and beautiful forever, although it might not last that long, but
Right. So there were a lot of things that were great about what you said, but one thing I did want to point out is that 6 hours is that magic number. So if your surgery is going to be planned for longer than 6 hours, then you are not really a good candidate for leaving and going home after the surgery. You should be absolutely recommended for an overnight stay with a nurse present. You know, I I will say that I have pushed that limit a couple of times
Mhm.
to like 7-8 hours, but ultimately 6 hours is really the magic number there.
Yeah. And if a surgeon told me like, if we do 8, you're gonna have to stay overnight, I'll be like, nah, that sounds like a risk. Let's just wait. Let's just do a second round just because.
What are your how did your friends and family react before, during, and after kind of the whole process for you?
My mom is super supportive. She's like, "Yeah, do what you want." So I love that. My husband, he's always like worried about the medical part. Like he's like, "Man,
Mhm.
that's the last one. Like that's it." But it's like he noticed, like he doesn't notice anything. So it's like when I felt fat, and I was like, "I need to do something's wrong with my stomach. It's sticking out. I have diastasis recti." He would be like, I don't see it, like everything looks fine. But it's like after I did it and I would show him before and after, he's like, dang, I didn't know you looked like that before. And I was like, come on now, I look like, but I guess he didn't really see it. But it was everybody was always supportive. There was never uh there was never any like, hey, don't do that. The BBL thing at first was kind of like skeptical. But once I learned like that's like one of the top issues is a BBL, then, once he knew I dropped that and want to do that, he was okay with everything. Everything
Yeah,
was pretty supportive. Yeah.
Good. Yeah, so BBLs have become the most dangerous thing that we do in plastic surgery. And I've talked about why that is in previous videos. But basically the technique has changed drastically from when that used to be a much bigger deal. And so it's less prevalent now. I will say that especially for people who are going to either non-board certified plastic surgeons, people who are not surgeons, we don't know what they're doing, right? And so we are still seeing deaths from BBLs in young, healthy women and men. And so another reason to make sure to go to a board certified plastic surgeon.
And one thing I also recommend that I see a lot is I see a lot of people in my groups talking about how, they do the medical blood test and something might not come back correctly. And then they're like, well, how can I pass this, or who can help me get clearance for this? And I'm like, why would you go around a plastic surgeon telling you like, no, you can't do this because of whatever is on your blood test, to still try to do the surgery? So it's kind of like those kind of things. People need to be careful with. And then I see a lot of people like, oh, well, this plastic surgeon won't do this because my BMI is too high. Who does high BMIs? And it's like, that's the importance of going to a board certified plastic surgeon, because they're going to tell you the risks and why you shouldn't do it if you're at a 50 BMI. So, that's one of those things where it's like people need to be educated on the reasons why, like why they can't do that. And why are you going around, doctor's orders, which is not cool.
Right. Yeah. The word no, for some reason, has become like a very taboo word. And people, I think plastic surgery, like a lot of things, has become a commodity. And so people think that if I have the money to pay for it, I should be able to just get it, no questions asked. And the thing is, it is a commodity, but it's also very, risk heavy. And so we want to minimize our risk, your risk, to be able to do things as safely as possible. So the word no should come out of someone's mouth if you're not ready to be a candidate for surgery.
Yes.
So you did have multiple surgeries. Did at some point you think you went too far, or never crossed your mind?
Nope, never crossed my mind. I felt like everything I did was needed because like I said, I'm a planner. I planned exactly what I wanted and, got exactly what I wanted.
Good. And did you have any
when I needed to? That was the other thing. I wasn't, people was like, I'm addicted. People are addicted to surgery. I'm like, no, I knew what I needed and I did everything naturally. I didn't, nobody even knows I had surgery. Everybody's like, I didn't even know you had a tummy tuck. I didn't even know you had anything. And I was like, that's how I want it. I don't mind telling people, but I don't want it to look like I've had surgery.
I was actually going to ask you that. Do you think plastic surgery is addictive?
No, I don't think
it definitely wasn't. But do you think that it has become something?
So I don't think plastic surgery itself is addictive, but I do think people are addicted to being perfect or trying to find the perfect look or the perfect thing. Like they're always going to find something wrong with themselves, even if it's not plastic surgery. It's just one of those things where it's like, okay, it's not plastic surgery. Now people are like, oh, my lips aren't full enough, or my face doesn't look like this, or it could literally be anything. So I wouldn't say plastic surgery in general, because sometimes people work out and they're addicted to working out because they want to look a certain way. So yeah, I do think mentalities are to where people are addicted to a certain look that they want to achieve in whatever kind of way it is.
If your daughter or son wanted to get surgery, what would kind of be your advice to them? And what would you say about them wanting to get surgery in the first place?
So I have a daughter, and I would say in life now that, I am who I am and I've experienced different experiences. My goal in general would be to ensure she's like eating right, staying fit, because my parents weren't like that. So I feel like we're in a different generation now, but I feel like me as a parent, if I do what I'm supposed to do, so that by the time she's older, she doesn't have any, imperfections of her body to where she's like, oh, I need to have plastic surgery. Like I wouldn't let her get on depot shot, because the only reason I turned into what I turned into the first time was because of the depot shot. I had like I would say perfect body in my early 20s before that happened. So I know not to let her do things like that. And then it's like after a kid, if she had a kid and she wanted to have plastic surgery, I mean, I'm just going to make sure, like I said, I educate her on everything, but I'm going to be all support because, like I said, I know exactly what to do and to ensure board certified plastic surgeons. So, things like that, I feel like I'm glad that I'm in that space to where I can educate her on that if she wanted to do it.
Perfect. Well, thank you so much. I really appreciate your joining us. I really appreciate your being the first guest because you are basically the perfect plastic surgery patient. You are coming in well-informed. You knew what you wanted. You are secure in yourself. And so had a limit too to where you were going to go. And I love all of that for you.
Thank you. Thank you.
Thank you again. Have a great night, okay?
Bye-bye.
Bye. All right, what do you guys think? Comments? She was lovely. She was absolutely lovely. I found her on TikTok because I wasn't sure if we were going to have guests tonight, but she really is the perfect example of what I mean when I say that patients should be informed before they come to the plastic surgeon about who they are and what they want. We obviously are the experts, and so we'll make recommendations based on what we see and what we perceive as your goals. But you want to be as informed as possible, point blank, period. So I want to shift gears now. I'm going to add to the stage my friend from college and my partner in business, Dr. Eneh. Hi.
Hey, good evening.
Dr. Eneh, do you mind telling us who you are? I gave a very, very, very brief introduction, but who you are, what you do. Yeah.
Sure. So, Dr. Eneh here, and I heard you and Tani talking about anesthesia. So that's kind of my wheelhouse. So, I'm a board certified anesthesiologist and pain management physician. So that's sort of my role when it comes to the surgical and perioperative space. So I just really loved that, you guys kind of touched a little bit on that, both in terms of cost and safety and things like that. But that's my career and that's my role and that's what I do, pretty much full time.
That's beautiful. And you are the only reason why it's possible for me to do what I do. So Dr. Eneh and I work together in KP Plastic Surgery, which is a plastic surgery clinic based primarily in Lagos. We also are, American born. We live in the US here and work in the US here. And so Lagos is kind of our part-time gig, our side hustle. But we have been doing amazing things in that space and hope to continue doing amazing things, bringing safe care to our fellow Lagos babes. Okay.
Yep.
The Dr. Eneh is here to discuss anesthesia and plastic surgery. So, first question: when you evaluate someone for anesthesia, what are you looking at?
I would say, briefly in a word, just looking for their suitability for general anesthesia. So I would say, kind of high level, if I'm assessing somebody for anesthesia for anything, for any type of surgery, the first question is this a good candidate for surgery? And part of that determination is how urgent or elective is this surgery. So when it comes to the cosmetic side of things, like Tani kind of alluded to, it's elective, right? For the most
Right.
part, if somebody says, hey, there's something going on here, we don't think you're optimized, is kind of the language that we use, then that's something that I would say, hey, this patient is not optimized, and I think that I will struggle to keep this patient safe while they are asleep under anesthesia for the surgery. So that's kind of the high level. I think you all talked a little bit about BMI. So BMI, I guess for the audience, it's twofold. Part of it does depend on where you're doing the surgery. Certain types of facilities have their own BMI cutoff.
Right.
So it's not always a question of whether the surgeon or the anesthesiologist is comfortable. Some facilities have a hard stop. We do not do anything in this facility over a BMI. Typically 40 is kind of the cutoff for
Right.
those facilities. And really that's just because there are a lot of risks that we can anticipate. And if that facility is not equipped to handle those risks that are more likely in patients with the higher BMI, they'll defer those patients to be done at a different place. So that's one thing that came up already. Other things are what sort of chronic medical problems that, you may have aside from the things that you can see about yourself that you're looking to change or enhance. We want to make sure that if you have any chronic medical problems that you either know about or maybe you don't know about yet, and we're about to tell you about them, we want to make sure that
Right.
those things are well managed, because for the most part, if it's a chronic medical problem that is well managed, in general, that's not going to make you a bad candidate for,
Right.
anesthesia or for surgery. On the flip side, if it's a chronic medical problem that you either don't know about or you are not managing well, that could put you at risk. Okay.
Right.
So like I tell all of my patients who are going for anesthesia, I always tell them that my job is twofold. One is to keep you safe under anesthesia, and two is to make sure you wake up comfortably at the conclusion of your anesthesia. Those are like my top two goals whenever I have a patient who's undergoing anesthesia. And there's a lot, if people in the audience have specific questions about things that they're going through, feel free to ask those. But I would say in general, those are kind of the high points of what we're looking for to make sure that somebody is a good candidate. Other things that let's say if you're, a young person who maybe is coming for a breast augmentation, you're young, you're excited, you saved up your money, you're ready to go. You've never had anesthesia or surgery yourself. Sometimes it's a
Right.
good thing to kind of ask the family, you don't have to tell them all your plans, but just find a way to slip it in there and see, hey, has anybody ever had any problems with anesthesia? Because some of the complications can be hereditary. So that's something that you can always just ask. So even if you yourself have never had anesthesia, you can just ask, your mom or a first degree relative how they've done, because some things are kind of common in a bloodline.
Perfect. Do you find yourself surprised sometimes at the patients that you're referred from surgeons, period, not just plastic surgeons, but surgeons,
Oh,
period, that they're
Chief,
not
all the
optimized
time,
enough?
all the time. Yeah. Uh-huh. All the
Fair
time.
enough.
But again, like I said, if it's, since we're talking in the cosmetic realm,
Yeah.
typically, because I would say that for most surgeries that are truly elective, everybody has the same goal and we're working on the same timeline of we
Right.
don't want any complicate. Like I'm thinking about what is the drop on this implant going to look like. I'm thinking about what the scarring is. The last thing that we want to be thinking about is, oh, there's a complication in the OR. So I would say I'm typically less, so shocked, at these type of patients. Sometimes we'll get into situations where this is kind of the good time to be talking about it. It's springtime, you've got a tickle in the back of your throat. Is it allergies? I'm not really sure. But then you come for your surgery, temperature is a little borderline, you had coughing a little bit. Yeah, so those things can happen, obviously, that might delay your surgery, but ultimately, again, it's always those two things. Can I keep you safe and can I keep you comfortable when you're waking up? So um, those are from a cosmetic surgery, I would say that those are typically, they're typically quite good, quite, well optimized, I would say, for the surgery that they're going to have.
Are there any characteristics about aesthetic surgery or outpatient aesthetic surgery that are unique? So are there any things that you would do differently for an outpatient plastic surgery patient versus other patients coming
Someone
in for
who's
like
going to be
colorectal
spending the night.
procedures?
Yeah, definitely. I mean, I think you kind of talked about your time cutoff. I think that's a good thing to kind of bring up. Again, we work and have the ability to work at any time of day or night, but if it's an elective case, you typically want to start that early in the morning because the recovery time is something that's kind of baked into some of those fees that people are
Right.
quoting you, because you have a team obviously that's dedicated to taking care of you in the operating room, but then there's also a team dedicated to kind of taking care of you in the recovery room. So when it comes to things that I would do specifically, of course, so depending on the type of plastic surgery, there are specific medications that I may use to minimize bruising, especially if it's like a facial plastics, facelift, something like that.
Mm-hmm. Mm-hmm.
Keeping the blood pressure down, things like that, making sure that we don't get into any elevated blood pressure. again, typically for a patient who's having cosmetic surgery that I know is going home, I want to limit things to kind of short acting. I don't want you to be, struggling to wake up in the recovery room 2 hours after your surgery, because I want to make sure when you leave that recovery room that I'm not concerned about how safe you're going to be getting home and then after you leave. Um,
Right.
and again, I would say plastic surgeons in general tend to be very, very good. Obviously, everything looks great, but I think you guys do a very good job with the local anesthetic can help a lot, to minimize the amount of pain medications that people require, which can also make them drowsy. And then for sure, especially in the typical patient populations that we see on the plastic site, making sure that people are not nauseated and throwing up, because it can happen that you're supposed to be going home that day, but you're
Right.
puking your guts out in the recovery room, and we can't send you home, nor do you want to go home in that
Right.
situation. So that also is something that I'm like keyed into. So for me in my practice, I ask every patient who I see, are you going home today? Are you scheduled for outpatient, or are you going to spend the night? Because that kind of will change my anesthetic management.
And how about for people who are getting multiple things in at once, maybe a longer surgery? Are there special things that you do there? I think you alluded to some of them, but if you don't mind kind of explicitly saying what you do to keep patients safe and then keep them kind of as pain minimized as possible.
Right. So anytime I have a patient coming for surgery, I'm always thinking, because specific, pain is kind of near and dear to my heart, both acute pain, chronic pain. So personally, I'm always thinking about how best can I make sure that this patient wakes up comfortably and leaves here, feeling good. So if it's anything that can be blocked, and by blocked, I mean, kind of like what they do at the dentist's office where they numb up a part of your body and then they can kind of work on it and you don't feel it for a few hours. So if there's any role for that, I always advocate for patients getting that. Anytime I see a long incision, I'm asking, hey, is there any local anesthetic in the room? I will advocate. I am your
You would hate me
advocate.
because I don't do a lot of
I am your advocate in the operating room. When you can't talk and you're asleep, I'm talking for you. Okay. If there's a lot of medicine in the room that we can give the patient, because I can give you all kinds of IV medications, but
Yeah.
like we talked about, I don't want you groggy and throwing up and all of that. One of the biggest things I would say for, like a multi-staged plastic surgery case, typically,
Yeah.
if you're doing a lot of removing a lot of skin, removing a lot of fat, it can cause significant fluctuations in your blood pressure, because
Yeah.
you're losing 20 pounds in like one slice, So
Yeah.
as far as the
Yeah.
work that your heart has to do, as far as your blood volume, it changes very, very rapidly. Okay. So for sure, I always like to make sure I know exactly what we're going in for. And then, making sure that I can keep up, right? If we're doing
Yeah.
lipo and we're suctioning, we're doing, all this fat is coming into the container. We have to replace that with, not
Right.
all of it, but I want to make sure that
Yeah.
you're not getting super dehydrated when all
Yeah.
of that stuff is getting sucked out. And then I guess this is kind of more technical, but I do think it's important for, people to understand that positioning is very, very important. If we're
Yeah.
doing a 360 lipo, you're not going to wake up, stand up, turn around, and lay back down. We have to
Right.
do that. And in doing that, we have to make sure that every part of you is protected: eyes, neck, arms, limbs. Okay.
Yeah.
So that can be that's always part of the calculation. How can I make sure that we do this transition safely? How can I make sure that we're monitoring closely? You don't want to have any lapses in monitoring, because obviously you want to do it quickly, but you also, safety is number one. So those are probably the
Yeah.
main things. And then I guess if it's a multi-stage, you always just want to make sure that if there's any potential for bleeding, right? Every
Yeah.
surgery to some extent will involve bleeding. So I want to make sure that, I'm prepared, you know, um, it's kind of morbid, but I would say that my job is to think of every single thing that could possibly go wrong and have a
Yeah.
plan. If this
Yeah.
happens, this is what I'm going to do, because you don't want to be in the midst of it, which is why we do fire drills at school, we do fire drills at work, just so when the thing that you never want to happen happens, you can handle it quickly.
Thank you for saying all of that. I think the one big takeaway that I got, I don't think everyone will understand the nuances, but the one big takeaway that I got was that there's a lot of mental calculus happening behind that curtain to make sure that as I'm resecting a big panis or what have you, that you're replacing the fluids and you're making up for the losses. So that is really, really huge. And also, it also highlights how important it is that our first priority is safety. And then second is ultimately the result. But
no,
absolutely first priority is safety. So that being said, there is this growing trend for doing things awake, right?
Mm-hmm.
So, or with a little bit of conscious sedation or MAC or what have you. So I wanted to do a little rapid fire with you. What do you think about awake lipo?
I think it depends on the extent of the lipo. If it's like, oh, lipo under the chin, you guys do that, right? I'm not a surgeon.
Right. So I think the trend is like awake, truncal, so abdominal, and sometimes 360. So basically prepping a patient's fully awake. They lay down themselves.
My eyes are opening and opening and opening. I mean, I think it can, I think it's a spectrum, just like everything in life. If it's a small body area, if it's a surgeon who's very skilled and this is what they do, hey, we're just gonna, you want a smooth flank and you have a little, little whatever, you just want to, sure. At this point, I'm not sure if people have seen a lot of lipo, maybe Miami, Dr. 90210, or whatever. It's like an orchestra in there. They doing this and doing that, and that trocar, it can go anywhere. I think if the patient is open to it and the patient is a good candidate and the surgery is also, it's a good surgery with a, very low likelihood of having complications, I think it can work. But one of the things that I do want to say is the concept of awake, that is also a spectrum. So I'm awake, you're awake, but most people who go to get surgery are not this awake. So for some patients, what I see a lot is people get very nervous about anesthesia, and I completely understand. You're in this place where now you're completely insensate. I mean, I can understand how freaked out that can be, but that is the job. That is my job when I come to see you, is to make you feel comfortable and to make you confident in my abilities. My hands are straight, no shaking. We're gonna get this, we're gonna do this, and we're gonna do a good job. Because what happens a lot of times, we make people's reels, you're awake, I don't have to put a breathing tube, but you're so drowsy and so sedated that now you're at risk from not the surgery having a complication, but now you're at risk because you've had so much anesthesia, but you're technically awake and you're breathing on your own, but it's insufficient, or I'm having to intervene a lot, or, because the smoothest surgeries are smooth surgeries, right? I don't want to have to keep reaching in and, I think oxygen, so it's the type of thing where it's super important to have a conversation with the team ahead of time. If I have any questions, I will ask the surgeon, hey, what's the plan? Now, if, I have a surgeon who tells me, hey, I do this all the time, this is what we typically give. If it seems reasonable, I'll say, sure, we'll go ahead and do that. If I have concerns, my job is to speak up and say, hey, this patient has maybe abnormal airway anatomy where they are prone to obstruction. They're probably going to need a breathing tube. This patient is extremely anxious, extremely claustrophobic. I don't know if I'm going to be able to, by the time I get them relaxed, it's going to be a general anesthesia. Because when
I do want to stop you for a second, because the reason, so you would be the whistleblower and you would be the one with concerns to share them with the surgeon. But the problem is that these procedures they're being billed as, we don't need anesthesia, so you don't need that cost, right? As Tanya said, anesthesia is a big part of the plastic surgery fee.
Cost, yeah.
And so, having you in the room as an anesthesia provider even if you're not providing anesthesia, is very expensive, right? And we know why. You are skilled at what you do. You're keeping people alive. That's very important, but it does cost money. So an awake facelift, awake lipo, awake breast aug, there is no person like you in the room. So what is your gut then?
I would say my gut reaction, if it was my family member, I'll loan you the money. How much is it? I'll loan it to you, because what is the cost of a human life? Have we ever come up with the value of that?
Right.
Again, to me, this is my thing. I'm not a hater. There's enough for everybody, you know? You don't want me involved, or you don't want an anesthesiologist involved. You feel confident, great. But as the patient, what I would say is just ask the team, hey, so what's the protocol if something were to go wrong? Just ask the question. Now, if they can give you a very coherent, cogent, okay, well, we're not going to use anesthesia for this case, but we have somebody in the next room. So anytime we get into, if they tell you something that makes you feel comfortable, I would say go for it, if you're leaning in that direction already. But nobody has gone into these things thinking that they would not wake up. That's not
right.
But we all know that it's happened. And unfortunately, a lot of us know somebody within 6 degrees of separation who has lost their life in the pursuit of some sort of, body ideal. So for me, I would say just make sure that you feel comfortable and you feel confident. If you ask the question, hey, if something were to go wrong, and they start saying, it's never happened. If they try and deflect, that would be a warning for me. If they can give you a plan, then I would say it's really kind of up to you to determine how comfortable you are with it. But my gut would be, nah, I want you, because the thing that people have to know, if there is no anesthesiologist, my assumption is that the surgeon is doing double duty. They're doing the surgery, but they are also directing the sedation. So now you have somebody who, remember I said a smooth surgery is a smooth surgery?
Yeah.
Now you have somebody that's like, oh, ow, ooh, ow, oh, wait, hold on, can you get, now they're doing multiple things at once, which, not to say that people
Usually
can't
is not a
multitask,
good
it's just,
idea.
is that the optimal scenario for you to get the outcome that you want, and not have to come back for a redo and then a redo of the redo.
Right. Absolutely. I agree. And I'm thinking of a woman now. She was 19 years old getting a breast aug under local. And it was the plastic surgeon's nurse who was administering anesthesia and monitoring her vitals. And unfortunately, she went brain dead.
Oh God.
And no one realized it for a little bit. So she
terrible.
ultimately died at 19 because of a breast aug, which is insane.
And I think nobody would go into that knowing that is even possible, let alone that likely, that's unfortunate.
Right. So I don't want to, that was a little bit of a downer moment, but what's one thing you wish patients knew about anesthesia before, going on their journey with plastic surgery?
I just, I guess I wish people knew more about it, because I feel like there's two kind of camps: people who are just so cavalier, like, oh, I'm ready to go to sleep. Why are you asking me all these questions? And it's like, okay. And then there's the people who are so nervous. So typically, and I will say this, not to toot my own horn, just because we're physicians, but we're human beings too. So anytime I see a patient, I'm thinking, if it were me, my family member, what would I go and explain it all? And it's like, oh, nobody's ever told me. I'm like, I'm going to tell you, because you're signing for it. I say sign here. You're signing that all the different things. I would just say I wish people knew a little bit more about what goes into it, because I think for the nervous people, it'll probably make them, a little bit less anxious about it. And for the people who are quite cavalier, it'll kind of explain why, why does it matter what your BMI is? Why does it matter, if you're going home or not? Or if your blood pressure is 220 over 115, just get it done. I want my new breasts. So to me, I just think that I wish that people knew more. And I guess I would add on to that, always know who is involved in your anesthetic care. There's never such thing as a stupid question. And when you have saved up your hard-earned money, you deserve all the time. Any question you have, go for ask it. Find out.
Yeah.
Is it an anesthesiologist? Is it an anesthesiologist working with the CRNA or nurse anesthetist? Is it a nurse anesthetist working independently? Is it a nurse working under the supervision of the surgeon? You just want to make sure you kind of know who your anesthesia team is going to be.
Yeah, absolutely. Okay. Dr. Eneh, thank you so much for that
No problem.
anesthetic breakdown. Now, I don't know if you were here for the intro, but what I did say is that no one is exempt from having the question asked, what have you had done? So Dr. Eneh, are you ready to reveal yourself?
I am
What have
ready
you had
to.
done?
How much revealing are we doing on this show? Is it a family show?
I mean, it's a family show. Keep it PG-13, but please share with us, what have you had done? If anything. I'm assuming nothing, but let's hear.
Surgery.
Yeah.
I'm trying to think. I've never had cosmetic surgery. I've had a little Botox a couple times. It's obviously gone. I had an under eye filler done, which needs to be topped up. And I'm working on a little wish list of things,
What's on your wish list? Tell us.
For a while there, I really wanted to get my diastasis repaired. Tanya already kind of talked about that.
Yeah. Yeah.
I'm like, ooh, just because I'm having back problems. So I'm like,
You are.
Yeah. And I'm like, oh, if I could just get my cord tight. The breasts always take a hit. I have 3 kids. The breasts are going down. Yeah. And then the hair transplant. I have these very strategic, salt and pepper bang things happening. But if I could get a hair transplant and not have to feel any of the pain, I probably would do that. Yeah.
What's stopping you? Is it just the pain, or what else is stopping you?
Oh, and then my teeth. Hold on. Let me. I would say for my teeth, my husband's like, do not get your teeth are fine. Don't do it. The hair transplant. To be honest with you, it's because I have 3 kids, and I'm like, you've inherited my hairline, so
Yeah.
I'm kind of it's the pain because I'm like, I don't want to be trying to sleep at night. It's like, I just need to be able to lay back and sleep. But then also, what do I tell because I have 3 daughters? What do I tell them when they get to the point and they're like, ooh, wow, you got your hair, and they are not loving things about themselves. I just feel like on some level, I kind of need to just lead by example and embrace my naturalness. And I really feel like, some of this is trendy. I feel like the trends now are leaning towards a diverse look,
Yeah. Yeah, you're right. You're right. And that is a big question I think a lot of us have, right? Is like, what do you, if you preach self-confidence, but then get plastic surgery, are you a hypocrite for then telling your daughters and sons you shouldn't get plastic surgery?
Right.
That's always a question, right?
Yeah.
Well, thank you so much.
No
thank you very much.
problem. Thanks for
I will
having
see and
me.
talk to you
This was
soon.
great. All right.
Have a good night.
Bye.
Oop, I cut her off a little too soon. So that is the show. That is revealed. Basically, people, you people coming on and talking to us about what you have had done. Now, I did not reveal what I have had done. So let me just do that quickly before we leave for the night. I, like Dr. Eneh, have had Botox. I used to put a little sprinkle right in this one wrinkle that's there. I haven't had it in over a year now, so that obviously has stopped. And I used to put a little bit right in here because I don't like that either. I don't have a wish list yet, but I am not opposed to a little nip and tuck. But I also don't like pain, and I don't like being out of control. So I've never been drunk, and I And I've had anesthesia for other things, but I don't like the idea of it. So we have to get over that hump. But anyway, that is the show. That is revealed. Hopefully you liked it. I was very nervous about doing this, but you guys have made it a pleasant first show. We will do this every third Friday of the month. So look for us in May. If you want to join us, again, obviously like and subscribe. Always, always, always love support from people, whether you be in LA, Niger, and everywhere in between. Comment as you have done. SamIamNP, thank you for being a supporter, a day one supporter. And then please actually join the live, right? And let us all share what we have had done, you have had done. As always, like and subscribe. And as always, love you lots and bye for now. We out.